basically, I had nothing to say that Valerie didn't already do it. And so I could go sit down except for two things. First of all, it gets back on schedule. And the second is, it wouldn't give me a chance to talk about alpha-1 antitrypsin deficiency. I don't have a PowerPoint. All I've got is the experience of being a patient. And if you think it's hard getting diagnosed as a COPD patient, which is extraordinarily difficult, you ain't heard nothing yet. I was diagnosed in I was 97, I guess it was. It was 1987 was the first time I walked into my doctor's office and said, something's wrong. I don't know what it is. And my family physician, who I've been going to for a long time, says, welcome to middle age. Was not what I wanted to hear, because that meant I'm in a situation that I can't do something about it. It was my parents' choice that I was born when I was and entered into middle age, and I can't fix it, but the doctor said it, so it must be right. I was raised in that period. I had the family doctor came to our house with this little black bag and a cigar. He treated me for rheumatic fever when I was 8 years old. My mother was a nurse. She went from 11 at night until 7 in the morning to the hospital to be with newborn babies. So if they said it was so, it must be. So I waited until the next year, and I came back and I said, it's getting worse, and it's more than it should be for middle age. So he decided, okay, fine, let's have you blow in this machine. And he says, yeah, you're not that old. So then he gave me an x-ray. Nice x-ray, clean. So the result of the breathing test and the x-ray turned out to be, gee, I don't know what you've got, but here, let me give you this thing in my drawer and try it and tell me how it works. It's my first introduction to an inhaler. No instructions on how to use it. Went on for a while. I was a little slow in the uptake. So I'm back again. And finally, I said, I can't do this anymore. I got to find me another doctor. When I first went in there, I was married. I had a 1-year-old daughter. This was starting to get in the way of a lot of things. I went to another doctor, and this doctor, he listened to the complaints. I told him I'd been to another doctor. He gave me a breathing test. He says, yes, you have a problem. Took an x-ray and says, I don't see anything, but I'm going to go send you to a specialist. And I thought, that is cool. So I went to this guy who had a box with 20 needles on it. He slapped it on my arm. And when my arm didn't explode, he said, you're not allergic to anything. I don't know what it is. So I went back and told him. He opened his drawer and gave me one of those plastic things and says, try this. This went on through 4 doctors. Sent to allergists twice. And I'm starting to lose it. So the last guy I go into did something really unique. He listened to what I had to say. He saw the breathing test. He didn't even go to the x-ray. He says, let me ask you a question. I said, yeah, what's that? He said, do you smoke? I said, yeah. He said, how long have you been smoking? I don't know, maybe 13 when I started stealing cigarettes from my dad. So it's been 40 years or so. And he says, stop smoking. And I said, then what? He said, once you stop smoking, then you can come back and see me, not until. And he gave me a sheet of paper that said all the wonderful things that are going to happen in my life when I stop smoking. And I said, okay, I'll do this. I can quit smoking. I've done it thousands of times before. And it wasn't easy. It wasn't easy. People saying, hey, I thought you quit smoking. I said, yeah, I did. They said, well, you've got a half a pack in your pocket. That's how ingrained it gets. I finally stopped. The stuff didn't happen. And it was either quit going to that doctor or going back there and doing something to him that I would probably go to jail for. And basically what happened at that point, I melted. I lost it all. I started accepting the fact that it was never going to change. It was going to keep on getting worse. I wouldn't be able to take care of myself. I wouldn't be able to, well, I didn't have a family anymore at that time because my wife was tired of me complaining that I couldn't do things all the time around the house. So I went into HR and said, you know, I really can't afford all this. I need to save my money. What's the cheapest thing you've got? And they gave me a sheet of paper with HMOs on it. I went down the list and I said, they're a mile from my office. I'll take them, and they're cheap. So the first thing I did was make an appointment. I didn't even have a doctor yet, so I saw this guy who was about 12 hours out of medical school. And I said, I was told by this doctor that if I quit smoking, my life was going to get better, and quite truthfully, it ain't. What are you going to do about it? He says, I'm going to refer you to somebody else. And he did. And I was referred in 10 years to the first pulmonologist I ever saw. And I walked in to Kaiser Permanente in Woodland Hills, California. Thank you very much. Dr. Lim was there. I went through my rant. He was by far the calmer of the two of us. And he said, I'm going to give you a series of tests. This last one, I'm sure it's not it. It's a blood test, but let's do it anyway. So I went through all those tests. He sent me home. 2 days later, they said, could you come back and do that blood test again? When I went in after that, he said, let me tell you what you have. Then I'll tell you what we're going to do about it. And then I'll tell you what I need you to do next. And I'll tell you what we're going to do next until we have everything going the way it should. And I thought, somebody who's taking control, I love this. He said, you have emphysema. Well, I knew this because my dad had emphysema. Of course, he didn't find it out until he had a heart attack at 50. And for the next 30 years, he pulled a tank around behind him. So, you also have adult asthma. Why didn't I have it as a kid? What is this? You know, who cares? Then he says, you also have alpha-1 antitrypsin deficiency. I couldn't even pronounce that. So, he then, after we went through a very long discussion period, he took me over to a respiratory therapist, introduced me. Respiratory therapist and I started talking about my smoking history and that I permanently stopped and how he's going to help make sure I stopped. He showed me my inhalers, how to use them. He showed me, I'm not packing heat here, by the way. I always carry this with me as well as my rescue inhaler. We're best friends, we go nowhere. He showed me how to use this thing, and all of a sudden, I did start getting better because I wasn't spraying all over my mouth. So this whole thing goes on. And that was really what got me going to be an advocate, because I realized the whole problem here was a lack of information on both sides, in the medical community and myself. They didn't know about alpha-1, and there's not enough doctors, far too many patients, and too many other more common things, so I understand that. I didn't know the questions to ask. So after some time of being diagnosed, I ran into somebody who had a support group for alpha-1 antitrypsin deficiency, and I started going to it, and I started getting informed. And that's when really things started changing. And what I realized is big long alpha-1 thing is COPD with a few extra ornaments stacked onto it. It's a hereditary condition passed on from parents to their children through their genes, and now they're starting to think a lot of COPD is genetic. It results in serious lung disease far earlier than it should in a normal COPD patient. There's also residual liver disease. When you talk about the 12-year-old and you might need a transplant, you should see a parent who's got a 3-month-old child who needs a liver transplant. That's scary. So we get diagnosed with emphysema as a primary disease. Other diagnoses, COPD, asthma, chronic bronchitis, bronchiectasis. We're usually susceptible to lung infections. And in us, any one of these things can cause further damage. Even if it's treated and taken care of, the fact that we get an irritant, our own immune system starts destroying our lungs. So a common cold for you could cause me to lose 5% on my FEV. So it's COPD taken to the extreme. Well, there's an organization of people who have this thing called the Alpha-1 Association. And they started out as a bunch of people who were gathered together by the NIH in a clinical trial to see if this missing protein could be replaced. Virtually none of them had ever met another alpha until this trial. They finished up the trials, they said it works, we're going to prove this, and thank you very much, by the way, we've run out of money, there's nothing else we can do for you. So this handful of people decided to form their own association to support, to educate, and to advocate for the alpha-1 patient. 5 years later, a few of them said, we can do more. we need to find our own foundation to raise funds to direct the research. And at the same time, they said, nobody knows how to manage this thing except us, so we're going to form our own healthcare management company, which is called AlphaNet. And every single one of the people who work for AlphaNet is an alpha. So here's this self-contained little universe. Scary part about it, they say there might be 100,000 of us. Only 10,000 have ever been diagnosed. So that's the size of our population. The programs we put together support us first and foremost to give somebody hope, because you're definitely ready to go over the bridge with this thing. There's about 80 to 100 of them around the country right now. I don't remember the numbers. We have virtual support groups for specialized areas like Alpha-1 kids, the liver transplant kinds, for caregivers, for people out in rural neighborhoods. But the whole purpose is to disseminate information, let them know somebody else is there is hope, and to give them ideas of what they can do in their community. We have a peer connection program, newly diagnosed, like Gary over here. We try and hook them up with an alpha who's got the same kind of problem so they can talk in each other, reinforce that things can be done. We've got a genetic counselor online. Not only patients, but family members, doctors can call them up, understand the genetics of this, the testing of it, which gets into a whole area of privacy because of insurance and things like this. It's one of the reasons we were involved in getting past the GINA laws, which protects your private information so somebody can't deny you insurance down the line. We've got a community discussion forum. Anybody goes on there, everybody tries to give them an answer. We have a roaming education day that goes to about 6 places around the country every year, loaded full of doctors, dietitians, any kind of people who can provide information and support for the people in the local community. We have a national conference every year where you get 500, 600, 700 people gathered together, what I like to call the largest Alpha-1 family reunion in the world, because we are all related by blood somewhere along the line. We do quarterly publications. The area that I'm having so much fun in now that I've been given the knowledge and the ability to do it is the process of monitoring and influencing federal legislation and regulations that affect the individuals and the families that have alpha. We accomplish this by collaborating closely with the Alpha-1 Foundation. We collaborate with any other organization who has similar interests. We worked with NORD when we got the legislation on orphan drugs passed. Worked with the COPD Foundation. We're here working with Breathe LA today. Transplant organizations. Anybody we can dovetail in with. In fact, there'll be a number of us in this room next month are going to Washington, D.C. to advocate with the American Association of Respiratory Therapists to try and get a bill passed that would allow lung-affected people to have better access to health care and better reimbursement for that health care. Tiny little bill that, on the global scale of things, will need billions of dollars in savings to the federal system, which is now paying, what, $50 billion a year in health care? And that ain't nothing compared to what's going to happen. So these are things that make sense to us as alphas. They make perfect sense to us as COPD people, because when you can't breathe, that's what it's all about. We are very fortunate that we have an incredible person by the name of Miriam O'Day, who is with us today. She is the Director of Public Policy representing both the Alpha-1 Association and the Alpha-1 Foundation. She's now representing the COPD Foundation. She represents AARC when needs be. She has formed most of these coalitions for us, because by ourselves, there's only a couple of us. Together with these other groups, we start getting a real mass of people who can get out there and do something. Our population is 10,000. I think we've done a lot of things, including oxygen on airplanes, other legislation we've gone in and affected. There are 12 million diagnosed COPD people. You think about the possibilities of that. It's absolutely staggering. This is the button from the Drive for COPD. I go out and work with them on testing. In a short period of time, they managed to test 2 million people. A very impressive number until you stop and think that's less than 1% of the entire population of the United States. we haven't even scratched the surface yet, and there's a long ways to go. Our program partners, the Association Foundation, Alpha Kids, AlphaNet, we come up with the programs based upon our community, what they tell us. Our partners, the augmentation companies, are primarily partners who fund us for everything. We also do some grant writing, individual grassroots fundraising. And everywhere we go, we try to figure out who can we work with to make an impact for the benefit of almost 10% of the population of the United States. So I have no idea what I've done with the time. This always happens. I don't have PowerPoints, I have notes and I ignore them all the time, and I hope I haven't rambled too much, but we need to work together, and together we can do incredibly great things. Margaret Mead, the noted anthropologist, said any change starts with one. So I ask you, let you be that one today.